So the soft tissue surface anatomy of the wrist, we're going to first start with the extensor side. So we're going to go through our 6 dorsal compartments. So our first one, we're going to come in here, and I'm going to have him bring his thumb up here, and I want to hold, and we're going to identify the first dorsal compartment, which is a combination of the APL, abductor pollicis longus, and EPB. The APL is going to be more radial. Just hold that for me. I'm going to outline it here. And the APL is going to come and attach at the base of the first metacarpal. And in some people, you'll be able to feel, and you can feel on him, a very definitive line. So here's the APL abducting the first metacarpal. EPB is going to go on to attach at the MP joint here. Good. Okay. The second dorsal compartment, I'm going to ask him to flex his fingers coming up, and I want you to hold that. This one sometimes can be a little trickier to palpate, but we're finding the extensor carpi radialis longus and brevis coming through at that second dorsal compartment. We can then palpate that as it reaches here the base of the metacarpals. So go ahead and relax for me for a moment. So here is our second dorsal compartment. E, C, R, B, and L are traveling together. Hold that. We know that the extensor carpi radialis longus is going to come up. It's going to attach at the base of our second metacarpal here. Okay. And our extensor carpi radialis longus is going to come in, and it's going to attach at the base of our third. Here. Good. Okay. Now, our third dorsal compartment here, go ahead and relax your fingers and bring your thumb up. This is our extensor pollicis longus, and it's going to come up and it's going to go all the way to the distal phalanx of the thumb. And we can trace that out here, coming in. It is the only muscle that can perform hyperextension at the IP joint of the thumb. Here. Okay. And it wraps around Lister's tubercle proximally, and we can palpate that line. So this is extensor pollicis longus, or EPL. Okay, good. Relax. And then we're going to take a look at our fourth dorsal compartment. I'm going to have him come up. I want him to make a claw. And I want you to hold that for me here. This is our fourth dorsal compartment. So it's going to contain our extensor digitorum communis as well as our extensor indicis proprius. And the EIP is going to go just ulnar to the EDC tendons. So let's first draw out here. Hold that for me. Here. Here is our fourth dorsal compartment. We're going to come in. Here's our tendon to the index finger. Here. Coming in. 4 and 5. And then we also have here our extensor indicis proprius. It's going to be just ulnar, so you're going to be able to palpate 2 tendons. On the radial side, extensor digitorum communis. On the ulnar side, the extensor indicis proprius, and that's the one that tends to be used for tendon transfers, especially after an EPL rupture. And relax for me. Okay, good. Fifth dorsal compartment, if he extends his small finger here, we identified this earlier with the bony surface anatomy. We follow this along, and this is going right along our here distal radial ulnar joint line. So extensor digiti minimi. And our sixth dorsal compartment is extensor carpi ulnaris. So I'm going to have him extend and ulnarly deviate, come toward me, and hold that for me. And ECU will be able to identify coming down here to the base of our fifth metacarpal. So I'm going to draw that out here. If you could just hold your hand here for me, using your other hand to resist. Coming in, perfect. And I'm going to be able to outline it right here. All the way to the base of my fifth. Good. Okay. All right, so our 6 compartments. First dorsal compartment, APL and EPB. Second, make a fist for me, E, C, R, B, and L, going to the base of our second for the longus. Third metacarpal for our brevis. Then we have the third dorsal compartment here, EPL, wrapping around Lister's tubercle. Fourth dorsal compartment, make a claw, hold there, have extensor digitorum communis, as well as EIP, extensor indicis proprius. Then we have, go ahead and relax, we have our fifth, if we come in and extend, extensor digiti minimi, and then our final one, our sixth, go ahead and make a fist and hold, extensor carpi ulnaris. Now we're going to go on to the volar side, and we just have two that we're going to identify. We have our flexor carpi ulnaris, and we're not going to identify palmaris. Some people have it, some people don't. The flexor carpi radialis, we're going to come in. I want you to keep your fingers straight. Come in and hold that. So he does have a palmaris. You can see that the center of his wrist, just radial to that, here we have our FCR tendon going through the sheath, and it's going to attach at the base of our second metacarpal. Relax for me here. So I'm going to come in here, FCR, and come in, and now when it goes through the transverse carpal ligament, it has its own little home through here. It does not go through the carpal canal, but then it's going to come out and it's going to attach to the base of our second metacarpal. So if you have a tendinopathy, here we're going to be doing our transverse friction at the base of our second metacarpal. If we have a tenosynovitis, we have to do our transverse friction proximal to that transverse carpal ligament because we can't access it through the transverse carpal ligament. And our final tendon we're going to identify is our flexor carpi ulnaris. So the flexor carpi ulnaris we know does not have a tendon sheath. That's the only one in the wrist. We come in, I want you to keep your fingers straight, hold that. Here we have FCU coming into the pisiform. Good, and relax. And the pisiform here is not the final attachment, but it's going to continue on here to the base of our fifth metacarpal. Good, and relax. We have FCR, flexor carpi radialis, and FCU, flexor carpi ulnaris.